I'm Scott Bennett, Associate Vice President of Solid Organ Transplant at UT Southwestern. I'm here to talk to you about the basics of transplant finance and the role of the Transplant Financial Coordinator, better known as the TFC. The Transplant Financial Coordinator, or TFC, is a valuable resource to help you navigate the process of transplantation. It'll help you navigate the evaluation, the wait list, the transplant, and the post-transplant period to ensure you have a successful outcome. Our financial coordinators will verify your coverage and eligibility at various points along the transplant journey. At the point of application, at the point in which our transplant team approves you for the wait list, and while you're on the wait list to maintain readiness at all times for that transplant event. At the time in which our transplant team approves you to be placed on the wait list, and throughout the time on the wait list to ensure the insurance company remains in approval of your transplant proceeding. It's very important to notify the Transplant Financial Coordinator if there are any changes in your coverage or eligibility. Failure to do so could interrupt your coverage, which could impact your ability to receive a transplant. Medicare is a federal government insurance program designed to help those over 65 years of age, those who have been disabled for 2 years or more, and those who have end-stage renal disease, or ESRD. Due to the ESRD entitlement, many patients on dialysis have Medicare. If the patient is on hemodialysis, there is a 3-month waiting period before entitlement begins. If the patient is on peritoneal dialysis, that waiting period is waived. And if a patient is not on dialysis yet, that's called a preemptive transplant, and that waiting period is also waived. If you're currently on group health care insurance, most companies observe a 30-month coordination of benefit period. After the 30-month period is expired, your Medicare will become primary and your group coverage will actually become secondary at that point. UT Southwestern is a Medicare-approved transplant facility. Medicare coverage comes in 3 parts. Part A coverage covers inpatient medical services in the hospital. Part B coverage covers outpatient hospital, physician, and immunosuppressant drug charges up to 80% of Medicare allowable rates. Medicare Part D covers non-immunosuppressant drugs, and your costs will vary based on the plan you choose. When traditional Medicare is your only coverage, UT Southwestern requires you as a patient to have Parts A, B, and D in order to be eligible for transplant. If you do not have Medicare prior to transplant, your social worker will discuss the option of accepting Medicare at the time of transplant as an option. There are other Medicare alternatives, such as Medicare supplements or Medigap plans and Medicare Advantage plans. Medicare supplements help to cover costs of Medicare that aren't covered under traditional benefits, such as copays, deductibles, and drug costs. Patients under age 65 are limited in the number of Medigap plans or supplement plans that they are able to obtain. There are now many Medicare Advantage plans to choose from. Medicare Advantage plans are private insurance plans that are contracted directly with Medicare to provide care. Although UT Southwestern is a Medicare-approved facility, UT Southwestern is not in network with all Medicare Advantage plans, so please contact your TFC before making any insurance changes. COBRA coverage is offered when you have a gap in employment. Although it's the same coverage that was once offered by your employer, it's often costly and limited in time frame. If you are on COBRA, speak to your TFC about options to reduce your cost or extend the term of your COBRA coverage. COBRA premiums are your responsibility. Your employer will no longer be paying a portion of your premiums as they once were. It is critical as a patient that you make timely premium payments in order to ensure that there is no lapse in coverage. Patients who generously offer to be evaluated for kidney donation are not responsible for the evaluation, hospitalization, or post-transplant follow-up for their care. Living donor transplant finance is complex, but in general, most living donor-related services are billed to the recipient. Depending on the recipient's insurance, they may not cover the rare instance of donor-related complications. Medicare, however, does cover donation-related complications. Living donor-related costs are another example of an advantage for taking Medicare when you have a qualifying event. Prospective living organ donors may be eligible for financial assistance to help cover travel costs. Check with your social worker for more information. To prevent your body from rejecting your new organ, you will have to take immunosuppressive drugs or anti-rejection drugs in addition to a variety of other medications to ensure the life of your organ. Many of these medications are very expensive. Without medication coverage, they can range anywhere from $5,000 to $7,000 a month in out-of-pocket expense. It is vital that you maintain adequate coverage to cover these expenses or maintain the resources to cover the out-of-pocket expense for your medications. Our social workers are also available to help with medication assistance programs where you may qualify. Reach out to your social worker for more information if you find yourself unable to afford medications. Any variation from your prescribed medication regimen can be detrimental to your transplant health. Once you have a better understanding of what your insurance covers, you'll have a better understanding of your responsibilities as a patient financially. Out-of-pocket medical and non-medical expenses that you should anticipate for the future include copays, deductibles, and premiums for your insurance coverage, transportation to and from the transplant center, parking at the transplant center itself, temporary lodging for family and friends during and after the transplant event, potential loss of income while out of work for the transplant, and childcare costs. Having a good understanding of your coverage and benefits and working closely with your transplant financial coordinator will help to ensure a successful transplant outcome.